So I want to start off this talk with a quick little question. When I say Ponce Health Sciences University, what really comes to mind? And I know a lot of you will have different answers, and a lot of people in this room, the honest answer is probably going to be some Puerto Rican school, or maybe you don't know anything about Ponce at all, and those are fair responses. But that's where we started. We were a small little school in Puerto Rico when we started about 10 years ago, 15 years ago. And I'm here to tell you today that these descriptions no longer fit. And the reason they no longer fit is because of the work you guys do in this room. When the student's sitting across from you at your desk, wondering what medicine is and if it's within their reach. I want to let you know that PHSU is an LCME accredited medical school. The same accreditation that accredits all medical schools in the United States and a few in Canada. Yes, we're located in the Caribbean, but every one of our students enter the MATCH, National Residency Match Program. We are also now a comprehensive health sciences university in the truest sense of those words. We have a doctorate of dental program. We have a doctorate of psychology program, a doctorate and master's in public health, and a bachelor's of science in nursing. These are not add-ons bolted on to a medical school. They are built within and have been pretty much for the tenure of the school, built in with the MD program. So that from day one, the students in all the programs are learning as an interdisciplinary program. So you're learning with students from nursing and medicine and dentistry. And that's how healthcare actually works, and that's how we train our students. And also our footprint goes well beyond Puerto Rico, well beyond a single campus, well beyond a single student population. We have full clinical campuses in Puerto Rico, in Ponce and San Juan. We also have 4 clinical campuses in the mainland, Chicago, New York, Miami, and St. Louis. 6 sites. And here's what makes our model particularly different from almost every other medical school or health science school you'll encounter at this conference. A student selects a clinical campus. A lot of times we talk about the first 2 years of medical school or health science school, and that's important. But the reality is the clinical training is the most critical part of a health education. And for us, we make sure our students do all their clinical training in a similar environment, not rotating through whatever slot happens to be available, 3 hospitals in 3 different cities. We're one campus, one community, one cohesive clinical experience from start to finish. And that's a deliberate choice. That's a deliberate choice we make, and I believe, sincerely believe, that is a significant clinical advantage that we provide. When clinical training is done in a consistent environment, it produces, in my opinion, again, better physicians. Physicians who are invested in their specific community. For a school who has a mission of helping serve underserved populations, that is exactly the point. But our reach doesn't stop at the U.S. border. And this may surprise you a little bit. Ponce Health Sciences University is an international medical school with partnerships and programs in Europe, in Spain particularly. What we have built there is not a standalone satellite clinic. It's an extension of the same curricular framework, the same assessment standards, and the same outcomes that govern everything we do in Puerto Rico and the mainland. Consistency is how you scale quality. We're not replicating a logo, we are replicating an entire system. A student who enters our ecosystem in Madrid and a student who enters it in St. Louis are preparing with the same rigor, evidence-based model. This is a differentiator you will not find in most institutions in this space, and it is how PHSU is positioning itself as a truly global health sciences university. Now, several years ago, my team and I, and one of my teammates is here, Mike, came across this uncomfortable reality. We were seeing students who were smart, who were motivated, and capable students who were stumbling their freshman year at university. A couple of C's in general chemistry, a rough semester in biology, and suddenly the dream of medical school they had hoped for their entire life starts slipping away. And in all fairness, even some of you guys as pre-health advisors might be advising your students that. And I'm here to tell you, a C your freshman year does not make your destiny, okay? But a lot of times the medical school admission pipeline sees it that way. But these students are disproportionately from lower socioeconomic backgrounds, underserved communities, students who have never had a tutor, never had a gap year, and never really had a safety net that a lot of their peers have. So what we did was we created and built this Master's of Medical Science to help solve for that. Now, I know there's about 250 post-bac programs in the United States. A lot of you in this room probably work for some of them. So let me be really direct in what makes ours different, because it's this difference that matters for your students you are advising. Most post-bac programs are standalone, right? They're designed to help improve the student's academic record, strengthen their application to medical school, and that is a very legitimate goal, okay? But when a program is not structurally connected to a medical school, there is a ceiling. These students are going to go into the same ACOMAS practice, they're going to enter the same application process, and re-enter this competitive landscape that they just didn't succeed in last event. So they're kind of in this difficult situation. At PHSU, our MSMS is embedded into our LCME accredited medical school. The program exists not just to improve the student's application, it exists to prepare them for the specific demands of a medical education. I'm going a little off script here. Medical school is not particularly hard. Taking a biochemistry class is not crazy hard. Physiology is not crazy hard. What makes it difficult is the volume, the triaging of the material, to be able to kind of take all this stuff in and adapt. That's why our MSMS program is very different. The students are sitting in the classroom with the medical students and being compared to them. And so what we do is we give these students a real shot, because what we're doing is we're assessing how they're doing on objective performance data. And what that does is it allows us to predict with a meaningful confidence how the students are going to do on the boards. The reality is no medical school dean wants to take a student who is going to fail the boards. It's a lot of work. It's a very tough day, and the student's going to have a lot of debt. That's going to be tough to pay for. So what we do is we've built predictive models to be able to assess that. And the thing is, we're not lowering the bar. We're not really looking at, if the student goes into the MSMS program, we're not really looking at their MCATs or their GPAs. We're looking to see if the predictive modeling will show that this student will make it through med school and pass the boards. So that allows us to have a whole different application pool, because we're not focusing on these things that a lot of the schools are. And so what it does is, by doing this, we're creating a longer runway. We're assessing the student for an entire year, seeing how they would actually do in a medical school curriculum. And what that does, it gives us a better predictive model, and you'll see why in a few seconds, how that's really come to fruition. So let me ground this in some numbers. I know all of you know this, but the average cost of medical school is about $300,000, probably a little over $300,000 now, with tuition, room and board, fees, books, travel, all that stuff. And a lot of medical schools are significantly more. The students I'm talking about are first generation, Pell eligible, from households that never really planned for this. They didn't set aside a bunch of money. So these students just don't face an academic barrier, they also face a financial one. At PHSU, about 80% of our students receive federally funded financial aid. The majority come from households that would be considered by any measure lower socioeconomic impact. These students are not playing with a cushion. There is no fallback if we take them. Getting it right, getting admitted to medical school, passing the boards, matching, getting into a residency program is not an aspiration for them. It is everything. It is everything. So the MSMS is designed for that reality in mind. It's not a remediation process. This is not a remediation to say, hey, you got a C freshman year, you need to redo something. What we're doing is we're building a pipeline, an accelerant for the students to make sure that they can make it through medical school. So it gives us the opportunity, our admissions committee, to take different students. And I know what you're thinking, does it work? You know, how does it actually work? And I'm here to let you know that it does. Our St. Louis campus posted a 100% match rate. That means 100% of our medical students got their very first residency choice. Thank you. But I think it's better than that, all right? Because over 50% of those students came from an MSMS program. All right, these are students that never got into any other medical school, right? They have a low MCAT, maybe their GPA was a bit messed up, And we took them in because they showed promise in our MSMS program. And they are now going back to become a physician. And these numbers are not participation trophies. We had 97% in Ponce. And the majority of our graduates go into primary care and disciplines in underserved communities. Over 50% of our students go into underserved communities and practice in the primary care discipline, which is what we try to attract as students. That's our mission. But I'm also here to tell you that our graduates also get some of the best residency programs: dermatology, urology, radiology, and of course neurosurgery. So we get into some of the most competitive residencies in the United States in academic medicine. Our commitment to our students doesn't end at the match. We, PHSU, operates residencies and fellowship programs that extend our mission across the full continuum of medical training. From the first day of medical school through advanced specialty education, when a student enters our ecosystem, they're not just being handed off at graduation. We are investing in where they go and who they will become. And we use data to make sure that happens. Through our partnerships with Tiber Health Corporation, we apply a predictive model that identify early on in the MSMS program how the student's going to do, which ones are on track, and when we need intervention. We build regression models, so what we're able to do is predict how the student's going to do on the board, and if they start tripping up, we can start intervening early, not just in the end of the year when it's too late. We can step in September, because we can see how they're trending compared to other medical school students who are their peers. And ultimately, what we're trying to do is identify how they're going to do on the USMLE. And by the way, I'm talking about medicine, but we also do this for dentistry and psychology and public health and some nursing. Nursing's a little bit tough because it's an undergraduate degree, so we're talking postgrad. But as long as there's some outcome metric, a board, some type of thing, we're able to apply these predictive models to do that. So a student who scores well on foundational questions, but struggles on multi-step clinical questions, early in the MSMS, we're able to identify where their troubles are and step in. And a little off script here, but one of the things that I notice is students like to study the things they're good at. Like they're good at physiology, and you see they're tripping up in biochem. You got to say, hey, look, you got the physio down, concentrate on this. And this is what the analytics does. And it's not just looking at, by the way, they got a B or an A in the class. It's looking at all the questions they get asked through the year. And I think that is the key differentiator between our institution that collects data, or people that collect data, and people actually use it. Because here's the thing. These students are sitting in the same classroom as their MD peers, these master students. And when we started this system, you can only create these type of modeling if you know what those outcome metrics are. And the only way to know what those outcome metrics are is to have a medical school and build your master's or your post-bac program within that medical school. So what we do is we have these medical students going through the curriculum. We know how they're doing on very specific questions. We know what their board scores are, and we can build regression models. We have an R of about 0.8. I'm being able to predict 6 months into this master's program or medical school what they're going to do on their STEP board scores. Okay? And I think that's a differentiator between us. You're all pre-health advisors. Students come to you because they trust to tell you the truth. And can they actually make it in medical school? These are very tough conversations. I've had hundreds of them. The worst thing you can do is tell a student they can make it through medical school and they can't. Right? You need to have a balance there. So you have to have these tough conversations. But if you have a student, you know, that student with a 3.1 GPA and a 500 MCAT, wondering what their path is, I'm here to tell you there is a path. There is a way for that student to become a doctor, to go back into a community and practice. If you have students who come from backgrounds where the odds were stacked against them, who, you know, maybe that traditional post-bac program doesn't really seem right for them, I'm telling you to talk to the people at PHSU. Our MSMS program is nationally accredited. It's data-driven. It's all data-driven. It's linked to a medical school that's looking to select these students from that. And again, it's an LCME accredited medical school. Even though we're in the Caribbean, we're an LCME accredited medical school. And to my knowledge, it's the only post-bac program that's linked to a school with 97 to 100% match rate for their students. So stop thinking about the biochemistry. Stop thinking about the first 2 years of med school. Think about what they're going to get afterwards and how that school is going to get them there. And I'm not asking you to send me every student. Don't send us every student. We're asking you to send us the right ones. The student who maybe got a couple C's freshman year and never stopped showing up to class. The ones who are working 2 jobs and studying on the bus. The ones who come from zip codes that produce no doctors in the last decade or 2. These are our students. These are the students we are actively looking for. Our founding mission was to produce physicians from underserved communities to go work in Puerto Rico. That mission has not changed. It's expanded. Okay? We operate across 6 domestic clinical campuses, soon to be 7. We operate in Europe and have an international medical school. We run an MSMS program with a direct link into our MD programs. We support our graduates from pre-medical school, through residency and fellowship. We use data to identify the needs before they fall behind. And also, by the way, that's why you have about 98% retention rate in our medical school, because we're able to use this data to step in if they start having some trouble. When you're in med school, what do you see? The dean gets up and he goes, look to your left, look to your right. One of these guys aren't going to be here. Anyone heard that? That's what it used to be like. I'm telling you, that's not how it has to be. And that's why we're a little bit different on this. So I'm telling you, this is not mission drift. This is mission at scale, which is what PHSU is trying to do. New Orleans is a city that knows something about resilience. Puerto Rico also knows something about resilience. It knows something about rebuilding in places the country has left and forgot. That is exactly the world we live in at PHSU. I'm very proud to be in this room with the people who make those differences for students who are going to become doctors, who are going to come and practice in communities of need, and are going to make a difference in society. One of the things I'd also tell these students is money comes and goes. You'll make a lot of money, you'll lose some money. The only thing that really matters in life is helping as many people as you can. And that's the students we want to get in our medical school that are going to go back into communities and make the difference and help as many people as they can. Thank you very much. I appreciate your time.